Life is full of challenges, and many of those challenges are physical. It doesn't matter how old or young, or how big or small you are, or what kind of shape you're in. As we journey through life, we put a lot of stress and strain on our bodies that oftentimes leads to injury. Signals like body aches, muscle strains, breaks, and nervous disorders tell us we may need a little help. When these things happen, a little physical therapy can go a long way to getting us back on track. Physical therapy is the treatment of disease, injury, or deformity by physical methods such as massage, heat treatment, and exercise rather than by drugs or surgery. And finding this type of medical assistance is getting easier day by day. Organizations like DMC are helping lead the charge to make physical therapy available to all. DMC Physical Therapy and Sports Medicine at the Summit on the Park is one such clinic.
Rehab Institute of Michigan is trying to get more small clinics within fitness centers. So you'll find us in some of the YMCAs. We're also in like the Romulus Rec facilities and some of those areas, just to make it a little easier for people that are trying to get physical therapy, that are active, that belong to certain facilities, that it makes it a little easier for them to actually get to physical therapy.
But while it's a medical facility per se, it's not a hospital. The responsibilities are a bit different.
Our responsibility here is a little bit different compared to a main hospital or main clinic, because this is a small health club site. We are inside Summit. It's a community center for Canton. It kind of looks as though it's a private run business because we don't have all the other set of rules which we would normally have in our main sites. So we are responsible for our patients, taking care of the clinic, and kind of do a little bit of office work for the insurances, calling the doctor's office, getting scripts, or getting authorizations for their treatment sessions. So it's a little bit more than normal main clinics. But we treat, and we have been doing this for years here in Canton, and we enjoy it.
As a smaller clinic, you won't find a lot of weights, just enough equipment to get the job done.
Most of the equipments, like the bike and the new step, are used for warm-ups. And then we have some small pulley system that we have inside the clinic that we use for weight training. When a patient comes in for pain, we do some deep soft tissue mobilization or range of motion that needs to be performed. We do it on the bed. Get them flexible and mobile, and then we get them to do the exercises.
Here, they specialize in strength, balance, flexibility, pain control, stretching, and manual techniques. After getting comfortable with the clinic's equipment, clients can take a step forward and use the Summits.
When it comes to strength, balance, flexibility, pain control, we can kind of do a realm of anything. We do normally any of the stretching and manual techniques and exercises more geared to things that you can do just at home with TheraBands, simple equipment while people are in here. But then we have access to all of Summit equipment. So if we have patients that want to use a gym, use weight room, go to the pool, do aqua therapy, our walkers or runners, we can use all of the Summit and kind of use their equipment for anything higher beyond that.
So it really works out well with our clients because we get a lot of patients who are member with the Summit. So it's an easy transition that we are able to rehab here and then take them to the gym and show the right way of using the machines. That's one way we're really different compared to other clinics who don't have that easy transition where the patient is not able to go to a gym and do it efficiently or properly.
One big difference here is that the connection between staff and clients go beyond the allotted time of therapy.
Being in the Summit is actually very beneficial because we get a lot of patients that come in because they're walking by our door heading to a workout and they're hurt and they want some information, they want to have rehab, they want to have physical therapy. So we're kind of convenient for them. But the other thing that we actually really like here is that Afterwards, our patients they either become Summit members or they are currently Summit members, so we get to see them afterwards. We get to see the progress 6 months from now, a year from now. We get to say hi to them as they walk by our hallway. We get to say hi to them when they're in their gym, working out. So for us, it's really nice because it's not just coming to therapy, being here for a few months and leaving. We kind of get to see people. We get to become kind of friends and family with our patients, and we get to see them in the long term besides being just in physical therapy.
Despite the benefits of physical therapy, some people have reservations about going. They think they don't fit the idea type of those who need it. However, physical therapy is beneficial to all and anyone can go.
We get every single patient you can think of. We've had patients as young as 7 and patients that are probably 95. So every age group, every fitness group, pretty much anything. We get people, teenagers trying to get back to athletics. We get older people after total knees. We have a few patients doing strengthening after car accidents, strokes. We kind of get pretty much anything. As long as people are kind of active, they want to get back into their normal routine, we kind of take anything that's orthopedic related. So.
A moderate clientele and a small staff enables the Summit DMC to provide more one-on-one service, which in turn gives the client that friends and family feel.
What I think makes us different is that we are a small clinic. There's only 3 staff members that work here. There's me, Shanti, and Deanna. So patients get to know us, we get to know our patients. So I think we can become more of a friends and family kind of location where we get to know each other, get to know our patients, get to know what our patients' needs are, what their wants are, and try to address that. Because our goal here really is to help you, but help you continue on beyond us.
Some of our patients would go to different clinics where they're always on a machine and the therapist is unable to spend time. Just because they're seeing a lot of patients at the same time, it is very hard to spend one-on-one with a patient nowadays. But here we do have the opportunity because it's a smaller clinic and it's only 2 of us here at a time.
Between the patients and us, we seem to be a team. Most of our patients want to come back. If they have a different ailment, they always come back because they want to come see us. They're sending their friends, they're sending their families. We have a good referral base from other patients here, which makes us feel good that they want their friends and family also to come here and see us. So I think that's what stands us out from everyone else, that we try to keep that family team kind of approach where we're kind of all working together. You know, you're going to get a good one-on-one customer service when you come see us.